Hello, my name is Ellie Gibb, and I'm a dietetic student here at the University of Alberta. I'm super excited to be doing cancer research this summer, looking specifically at the changes that occur in lipid and muscle-related biomarkers in head and neck cancer patients. People who have cancer often go through many intensive treatments, including chemotherapy, radiotherapy, and many undergo surgery. We have seen that cancer patients rapidly lose muscle, body weight, and become weaker, which leads to a decline in quality of life and is associated with decreased cancer survival. On top of this, head and neck cancer, which includes cancer in the mouth, throat, and larynx, is especially hard on patients' nutrition, with malnutrition increasing up to 77% during treatment. This is because of where the cancer is specifically located and how it interferes with appetite and their ability to eat. Fish oil supplements have been something that researchers have looked into for a long time, and specifically the fatty acid EPA, which is a specific omega 3 fatty acid. EPA supplements have shown promise in reducing the amount of muscle and weight loss that happens with cancer patients. This is because of the anti inflammatory effects it has, stopping inflammation, which is the main driver of muscle breakdown in cancer. Our specific project builds on a clinical trial recently done in Spain. We're specifically looking at the blood samples from the head and neck cancer patients over time, before, during, and after treatment. We want to see what is happening with the blood by measuring biomarkers, which are molecules that reflect how the body is managing fat, muscle, and inflammation. We specifically will be looking at things like sphingolipids, phosphatidylcholines, choline, and myostatin. These molecules may be able to tell us what is more specifically happening inside the body during treatment. Research has shown that cancer patients may respond very differently to supplementation of fish oil or EPA. So, is there something in the blood that we could find that determines a patient will be more susceptible to muscle and weight loss? Then, in turn, we can start treatment or nutritional support earlier on to better help patients maintain as much body weight as possible, which allows them to have a higher chance at cancer survival. This research is so important because it helps us to improve the lives of people living with cancer, and especially those with head and neck cancer, as they are severely susceptible to disease-related weight loss and loss of function. This problem in cancer patients is very common, yet under-recognized. We are still in the early stages of this project, but as we dive deeper into analyzing the blood samples and looking for trends, relationships, it will be very insightful for us to see if certain hypotheses are correct. The bottom line is that we need to better understand how to detect and treat cancer patients as individuals rather than a whole group. We know that each person reacts differently to different cancers, and if we can test cancer patients earlier on, we can start treatment and intervention to prevent muscle and weight loss earlier, and then increase chance of survival and improve quality of life. Thanks for watching.